All right, deep divers, get ready, because today we're gonna tackle mild to moderate ulcerative colitis in adults, specifically those considered low risk.
Should be a good one.
It should be. And our trusty guide is UpToDate, like the doctors go to.
Oh, yeah. UpToDate. It's like the ultimate medical encyclopedia.
Exactly. And we're diving deep into an article by, let me see if I can, doctors Jana Al-Hashash and Miguel Reguero.
Sounds pretty official.
Definitely. So if you're ready to take control of your UC journey, we're going to break down all the essentials. So let's jump right in. The article, it starts off talking a lot about disease activity and risk. What's the deal with those two terms?
Well, when it comes to UC, it's really important to know where you stand. And activity is basically how much inflammation is going on at the moment.
Okay, so is it just a little flicker or is it a full-blown bonfire?
You got it.
Gotcha. And then the article uses terms like mild, moderate, and severe UC. How do doctors actually tell the difference? Obviously, no one should self-diagnose.
Oh, absolutely. Always consult your doctor. But just to give you an idea, mild UC, you might be making a few extra trips to the bathroom, maybe a little blood, but nothing too crazy.
Yeah.
Moderate UC is when they get a bit more intense. Looser stools, more blood, maybe some anemia, cramps. You're definitely feeling it.
And I'm guessing severe UC is a whole different...
Oh, yeah. Severe is a whole other story. It's a serious situation. Frequent bloody diarrhea, intense pain. You might even have fever, weight loss. That's definitely a time to call the doctor ASAP.
Got it. So activity, we kind of got that down. What about risk?
Risk helps doctors predict your chances of having long-term problems, like needing surgery. Your age, your symptoms, the lab results, how much of your colon is affected, they all play a part.
And speaking of how much of the colon is affected, there were some words thrown around in the article like proctitis, extensive colitis. What do those actually mean?
So those terms tell us how far the inflammation spread in your colon. Like proctitis means it's just in the rectum, the very end.
Okay.
Proctus sigmoiditis, that's a little further up. Then you've got left-sided colitis, which means it's reached the descending colon. And extensive colitis, well, that one's pretty self-explanatory. It's widespread.
So it's like a map of where the inflammation is.
Exactly.
Okay. And I'm assuming colonoscopies are pretty key for figuring this all out.
Absolutely. It not only helps diagnose UC, but also lets doctors see exactly how much of the colon is inflamed and, how bad it is.
So knowing the activity, the risk, and how far it spread, that helps your doctor, customize a treatment plan, right?
You got it.
Yeah.
Someone with mild proctitis who's low risk might just need a topical medication. But if you've got extensive colitis, you might need something a little more aggressive.
Okay, so this is all starting to click. So before any treatment starts, the article really stresses a thorough evaluation. What exactly does that look like?
Think of it like a detective gathering clues. They'll start with lab tests, blood count, liver function, albumin levels, and one really important one is the C-reactive protein test.
CRP, right? What's the significance of CRP?
That's our red flag for inflammation. High CRP means there's a fire somewhere.
Makes sense. And the article also talks about stool studies. What are those all about?
Another piece of the puzzle, one thing they test for is fecal calprotectin, and that's another sign of inflammation. They can also use those tests to rule out any infections that might look like UC.
So blood work, stool samples,
Yeah.
more colonoscopies?
Not always. If your recent colonoscopy was clear and your CRP and fecal calprotectin levels are low, your doctor might not need another scope right away.
But if those numbers are high, or it's been a while since the last colonoscopy, that's back to the procedure room.
Pretty much. We're talking mild to moderate UC here. More severe cases, especially if there are concerns about complications, they might need a flexible sigmoidoscopy instead of a full colonoscopy.
Okay, so this initial evaluation, it's like laying the groundwork for the whole treatment plan.
Exactly. It's like building a foundation. Once the doctor has all that information, they can start tailoring a treatment plan.
Awesome. And speaking of treatment, UpToDate divides it into two phases: inducing remission and maintaining it. What does inducing remission actually mean?
Basically, it's like putting out the fire. We're trying to get rid of that inflammation and let your colon heal. It's not just about feeling better, it's about protecting your colon from long-term damage.
Right, so it's not just a Band-Aid solution.
Exactly.
Okay, so how do doctors go about inducing remission?
Well, the approach really depends on where the inflammation is in your colon. Remember those terms like proctitis versus extensive colitis. That plays a big role. And of course, how severe the inflammation is. Let's start with proctitis and proctosigmoiditis, since those are usually the simpler cases.
All right, proctitis, proctosigmoiditis. Starting to remember those. So what's the first line treatment for those?
Usually it's topical mesalamine. It comes as a suppository or an enema, and it goes right to the source of the inflammation.
Why go topical instead of just taking a pill?
Well, it delivers the medication directly to where it's needed, so you have fewer side effects. Plus, those enemas, they can actually reach pretty far up into the colon, sometimes even past the sigmoid colon, so they're more powerful than people might think.
Wow, that's impressive. So how long does it take for the topical mesalamine to work?
You might feel some relief within a week, but full remission usually takes a few weeks, maybe even a couple of months.
And what happens once you're in remission? Can you just stop the medication?
Not so fast. That's where maintaining remission comes in.
Right, of course. But what if someone, can't handle those topical medications?
Yeah.
Or the mesalamine just doesn't seem to be working? What are the other options?
Well, if topical mesalamine isn't a good fit, we might try topical glucocorticoids, which are steroids that work by calming down the inflammation. They come as a suppository, enema, or even a foam.
And are there any downsides to using those topical glucocorticoids?
The main concern is using them for too long. You can get side effects like thinning of the skin, so doctors usually limit their use to a few weeks.
Makes sense. So we've got topicals for proctitis and proctosigmoiditis. But what about when the inflammation is more widespread, like those left-sided or extensive colitis cases?
When we're dealing with inflammation beyond the sigmoid colon, we need to bring in the reinforcements. We usually start with a combination of high-dose oral mesalamine, that's the pill form, and a rectal mesaline enema.
So attacking it from both inside and out.
Exactly. The oral medication works systemically, while the topical treatment targets those specific areas in your colon.
Okay, why start with high-dose oral mesalamine right away?
Well, research shows that going in strong is actually more effective for inducing remission. Like putting out a fire, you want to douse it with as much water as possible right from the start.
Great analogy. So you start with that combo. What happens if that doesn't work?
If the inflammation is being stubborn, we've got a few more tricks up our sleeve. One option is to switch that topical mesalamine for the topical glucocorticoids we talked about earlier. Another option is to add a medication called budesonide MMX.
Boots on MMX. Sounds like a secret weapon. What's that all about?
It's a pretty cool steroid. It releases its power specifically in the colon, so it targets the inflammation directly while minimizing side effects elsewhere.
That's impressive. And what if those options still don't work?
Well, in some cases, we might have to bring in the big guns, oral prednisone. It's a stronger steroid, but it's not ideal for long-term use because of the potential side effects. And if it gets to that point, your doctor might recommend other therapies like biologic agents, which work by targeting specific parts of your immune system. But those are usually reserved for more complex cases.
Right, we're sticking to the simpler ones today. So we've covered putting out the fire, inducing remission. Now, what about preventing that fire from reigniting, maintaining remission? Who needs maintenance therapy?
Well, not everyone needs it. If you have ulcerative proctitis and your flares are rare, you might be okay. But for most people with proctosigmoiditis or colitis that's spread beyond the sigmoid colon, they usually need some kind of maintenance therapy.
Makes sense.
Yeah.
So for those who do need it, what are the go-to options?
It really depends on you, what worked for you before, how much of your colon is affected, what you prefer, and even your insurance coverage. It's about finding the right fit.
Okay, so lots of factors in play. Can you give me some specific examples?
Sure. So let's say you have proctitis or proctosigmoiditis, and you got into remission with that topical mesalamine. You'd probably keep using that maybe once a day to stay in remission.
And what if, someone can't handle those daily topical treatments?
Well, we can adjust the frequency, maybe every other day or even twice a week, although there's not a ton of research on those less frequent schedules. It's really about finding what works for each person.
Personalized approach, always. What about folks who needed oral meds to get into remission?
If you achieved remission with an oral 5-ASA agent, like mesalamine, you'd usually keep taking that, but at a lower dose, like turning down the water pressure once the fire's out.
I love that.
Right.
So you're aiming for the lowest effective dose to minimize those side effects.
Yeah.
Now, what about those other meds, the glucocorticoids, budesonide, MMX, prednisone? Are those ever used for maintenance?
Not typically. They're great for tackling acute inflammation, but not ideal for the long haul because of those side effects.
Good to know. We've covered a lot of ground here. But before we move on to troubleshooting and health maintenance, I'm curious, how do doctors actually know if the maintenance therapy is working? Are they just going by how you're feeling?
Well, while how you're feeling is important, it's not the whole picture. Remember, the goal is complete mucosal healing, not just symptom relief. So doctors use a few tools to keep an eye on things.
Like what?
Well, regular colonoscopies are still key, even when you're in remission. They give your doctor a chance to see how well your colon is healing. Plus, we also use those non-invasive biomarkers we talked about, CRP and fecal calprotectin. It's like checking the smoke detectors, even when the fire's out, just in case.
So monitoring regularly helps to catch any signs of inflammation early so you can adjust treatment before things get out of hand.
Exactly.
Okay, that makes sense. We've talked about inducing and maintaining remission, but what if, the initial treatment just isn't working? Should people panic?
No, no, not at all. There are several reasons why treatment might not be effective. It's not time to freak out just yet.
All right, so let's talk troubleshooting.
Yeah.
What are some common reasons a treatment might not be doing its job?
Well, one of the first things we look at is medication compliance. Are you actually taking your medication as prescribed? This is especially important for those topical treatments.
Because those can be tricky to use.
Exactly. Sometimes people struggle with the application or they find it uncomfortable, so they might not use it consistently. That's why it's so important to talk to your doctor if you're having any issues with your medication. They can offer tips, maybe suggest a different option.
So open communication is key. What else might be going on?
Well, sometimes the disease might be progressing even with medication. If the inflammation's getting worse, we might need to switch to a stronger medication or add something else.
Is it ever possible that what they think is UC is actually something else entirely?
Absolutely. That's another thing we have to consider. If the usual UC treatments aren't working, we may need to reevaluate the diagnosis and see what else might be going on.
So ruling out other conditions is important. But what about managing symptoms while you're figuring all this out? Are there medications that can help with that?
For mild to moderate UC without any serious complications, there are a couple of options. Antidiarrheal medications, like loperamide, can provide short-term relief from diarrhea.
What about those over-the-counter pain relievers, like ibuprofen or naproxen? Are those okay to use?
It's best to avoid those. While the evidence isn't totally clear-cut, they could potentially worsen the inflammation in your gut.
Okay, good to know. So opioids are off the table, and we want to avoid NSAIDs like ibuprofen and naproxen. Got it. This deep dive is packed with useful information already. We've covered diagnosing UC, understanding its severity and risk, and explored different treatments for inducing and maintaining remission. We even tackled some troubleshooting tips. But before we wrap up for today, there's one more crucial piece to discuss: health maintenance.
You're absolutely right. Managing UC isn't just about medications. It's about a holistic approach to your health.
So what are some key things people with UC should keep in mind when it comes to their overall health? Where do we even begin?
Well, we could start with vaccinations. Staying up to date on your vaccines is important for everyone, but it's especially important for people with UC, especially those taking medications that can suppress the immune system.
Right, because their immune system might not be as strong at fighting off those infections.
Exactly. And then there's cancer screening. People with UC have a higher risk of certain types of cancer, so being proactive about screenings is really important.
Now, you mentioned a Crohn's and Colitis Foundation checklist earlier. Does that cover any of this?
It does. They recommend talking to your doctor about specific cancer screenings like colonoscopies and whether you need any extra vaccines depending on your situation.
So that checklist is a great resource. What about bone health? I vaguely remember something about that.
Yes, UC can increase your risk of bone loss and osteoporosis. So your doctor might recommend a bone density test, especially if you're postmenopausal, if you've been on steroids for a while, or have other risk factors for osteoporosis.
Wow, there's so much to keep in mind. Vaccinations, cancer screenings, bone health. It really shows how important it is to be proactive and have those conversations with your doctor.
Absolutely. It's a team effort, working together to manage your UC and keep you healthy.
This has been so insightful, but I feel like we've just scratched the surface. There's so much more to explore.
There is. The research on UC is constantly evolving, leading to better treatments and hopefully even better outcomes for patients.
And that's what I'm really curious about. What are these new treatment approaches? What's on the horizon?
One of the most exciting areas is personalized medicine, where treatments are tailored to your specific needs and characteristics.
Instead of a one-size-fits-all approach, it's about finding the perfect fit for you.
Exactly. It considers your genetics, your medical history, your lifestyle, even your gut microbiome.
It sounds like the future of UC treatment. How do doctors personalize those treatment plans?
Well, researchers are working on identifying biomarkers, which are measurable indicators that tell us more about your specific type of UC. These biomarkers could be anything from genetic markers to blood tests, stool analysis, even assessments of your gut microbiome.
So you can imagine a future where you go to the doctor, they do some tests, and they say, okay, based on your unique profile, this specific medication at this exact dosage will probably work best for you.
That's the ultimate goal, and we're getting closer all the time.
That's incredible. But what are the challenges of making personalized medicine the norm for everyone with UC?
The biggest hurdle is the complexity of UC itself. It's influenced by so many factors: genes, environment, lifestyle. It's like trying to solve a giant puzzle. But the good news is that research is moving forward rapidly, and new technologies are helping us analyze data like never before.
So it's just a matter of time before personalized medicine becomes the standard of care.
I believe so. It's an exciting time to be in this field, and it gives me a lot of hope for people living with UC.
This deep dive has taken us on quite a journey, from understanding the basics of UC to exploring these cutting-edge treatments. I've learned so much, and I'm sure our listeners have too. But before we wrap up for today, I want to circle back to something you mentioned earlier, the importance of lifestyle factors. We talk about diet a bit, but what about other lifestyle modifications? Can they really make a difference in managing UC?
Absolutely. While lifestyle changes can't cure UC, they can play a big role in managing symptoms and improving your overall well-being.
So let's get specific. What are some key lifestyle factors people with UC should pay attention to?
Stress management is a big one. Stress can really worsen those UC symptoms, so finding healthy ways to cope is essential.
Easier said than done. Any practical strategies?
There are lots of options. Exercise is fantastic for stress relief. Even gentle activities like walking or yoga can help.
Yeah.
Mindfulness practices like meditation or deep breathing are incredibly helpful. And of course, don't underestimate the power of connecting with loved ones, enjoying hobbies, or simply doing things that make you happy.
All those sound great, not just for UC, but for everyone. What about sleep? How does that factor into managing UC?
Sleep is like a superpower. When you're sleep deprived, your body produces more inflammatory chemicals, and that can worsen UC symptoms.
So getting enough sleep is crucial. Any sleep hygiene tips?
Consistency is key. Aim for 7 to 8 hours of quality sleep each night, going to bed and waking up around the same time. A relaxing bedtime routine like a warm bath, reading, or listening to calming music can do wonders. And make sure your bedroom is cool, dark, and quiet.
All great advice. It sounds like these lifestyle factors can really make a difference in how you manage your UC.
Absolutely. It's all about taking a holistic approach, addressing both the physical and emotional aspects of living with UC. These lifestyle changes aren't just about symptom control, they're about enhancing your overall quality of life.
I love that. This deep dive has been incredibly informative and empowering. I feel like I have a much deeper understanding of UC, not just the medical stuff, but the importance of self-care and lifestyle choices too.
That's what we aim for. Knowledge is power, and understanding your condition is the first step to taking control of your health.
Well said. We've covered so much ground today, from diagnosis to treatment to lifestyle changes. What's the one takeaway you'd like our listeners to remember?
While UC can be challenging, remember that you're not alone. By staying informed, working closely with your doctor, and taking a proactive approach to your health, including those lifestyle changes, you can live well with UC.
That's a great message to end on. I'm sure our listeners are feeling empowered and ready to take on whatever challenges UC throws their way. Thanks for diving deep with us today.
It was my pleasure. Always happy to share knowledge about this fascinating condition.
And to our listeners, thanks for joining us. We'll be back next time with another exciting deep dive. Until then, stay curious.
You know, it's really amazing. There's so much research happening in the UC world right now. Like we have way more options than we used to, and new treatments they're popping up all the time.
It's true. It really feels like we're moving toward a future where treatment is like super personalized, which is really exciting. But before we get too ahead of ourselves, let's go back to some of the practical stuff about managing UC. We talked about how important it is to take your medication correctly. Any tips for making sure that actually happens?
Well, one of the biggest challenges, especially with the topical medications, is making sure they're used correctly.
Right.
For example, with enemas, you really want to hold that medication in for as long as possible to let it really do its thing.
I can see how that would be tough, especially when you're not feeling great.
Exactly, exactly. And, there are techniques that can help, like lying down in a certain position or maybe trying some relaxation techniques, your doctor or a nurse can show you the best way.
Yeah, those practical tips, they can make a world of difference.
Oh, absolutely. And remember, don't be shy about talking to your healthcare team if you have any questions or concerns about your medication. They're there to help.
Absolutely. Speaking of concerns, what are some red flags that might mean someone needs to, rethink their diagnosis or consider a stronger treatment?
Well, if your symptoms are getting worse, even though you're taking your meds, that's definitely a sign that something needs to change.
Okay.
Also, keep an eye out for signs that the inflammation might be spreading beyond your gut, like fever, significant weight loss, or severe abdominal pain. Those could mean the UC is more serious than initially thought.
So if things aren't getting better or if they're taking a turn for the worse, don't just try to tough it out. Reach out to your doctor.
Exactly. The earlier you catch these issues, the better the chances of, preventing complications and getting your UC under control long term. And speaking of long term, let's dive into the world of health maintenance for people with UC. This is where things get really interesting because it's about, taking care of your whole self, not just your colon.
Right. It's about so much more than just the UC. And we talked about vaccinations earlier. Are there any specific vaccines that are especially important for people with UC?
Well, all the usual vaccines are important, but some, deserve a little extra attention. For example, the pneumococcal vaccine is really important for anyone taking medications that suppress the immune system.
Okay.
They're more vulnerable to infections, and pneumococcal disease can be really serious.
That makes sense. What about the flu shot? Is that a must-have for folks with UC?
Oh, absolutely. The flu can hit people with UC harder than the general population, especially those who are on immune suppressing meds.
Right.
So getting your annual flu shot is a simple but powerful way to protect yourself.
Flu shot, pneumococcal vaccine, check. What about other preventative measures?
Let's talk cancer screening. Remember, people with UC have a higher risk of certain cancers, so being proactive about screenings is essential.
Let's break it down. What specific cancers are we talking about, and what are the recommended screening guidelines?
Well, colorectal cancer is a big one. The exact screening recommendations will, depend on how much of your colon is affected and how long you've had UC. But in general, you'll probably need colonoscopies more often than someone without UC. Your doctor will help you, figure out the right schedule.
So more colonoscopies, but it's worth it if it means catching cancer early. What about cervical cancer?
Well, for women with UC, especially those on immunosuppressants, it's really important to get screened for cervical cancer every year. And this is where being your own advocate comes in. Studies show that women with UC are actually less likely to get regular cervical cancer screenings, so don't be afraid to remind your doctor and schedule those appointments.
Got it, adding that to the calendar. And what about skin cancer?
Anyone with UC who's taking or has taken medications that affect the immune system, like immunomodulators or biologics, they should get a yearly skin exam by a dermatologist. These medications can increase the risk of both melanoma and non-melanoma skin cancers.
Wow, it really shows how important those regular checkups are.
Yeah.
So we've got vaccinations, cancer screenings. What else falls under the health maintenance umbrella for people with UC?
Bone health is another important one.
Right. You mentioned that UC can increase the risk of osteoporosis. Why is that?
Well, there are a few reasons. The inflammation itself can impact your bones. Some medications used to treat UC can increase bone loss, and nutritional deficiencies, which are more common in people with UC, can also play a role.
So how do you address this increased risk?
Your doctor might suggest a bone density test, especially if you're postmenopausal or if you've been on steroids for a long time, or if you have other things that put you at risk for osteoporosis.
And what about those nutritional deficiencies you mentioned? How do those fit into the whole health maintenance picture?
Well, unfortunately, nutritional deficiencies are pretty common in people with UC. Iron deficiency anemia is a big one, and you can also be low in vitamin B12 and folate.
Why are these deficiencies so common? Is it because the body's not absorbing nutrients properly?
It's a combination of things. Malabsorption can definitely play a role, especially if there's inflammation in the small intestine. But blood loss from UC can also lead to iron deficiency, and some medications can, interfere with how your body absorbs certain nutrients.
Okay, so regular blood tests to check for these deficiencies are important.
Yeah.
Now, what about diet? Is there anything specific that people with UC should be eating or avoiding?
That's a great question, but honestly, the best thing to do is to talk to a registered dietitian who specializes in inflammatory bowel disease. They can help you create a meal plan that meets your individual needs and preferences.
Personalized advice, as always.
Yeah.
We've talked about vaccinations, cancer screenings, bone health, nutritional deficiencies. Anything else we should cover?
We can't forget about mental health. Living with UC can be incredibly stressful and emotionally draining. Many people with UC experience anxiety, depression, or both.
It's so important to acknowledge that emotional side of things. What are some resources or coping strategies that can help?
First and foremost, don't hesitate to talk to your doctor about any mental health concerns you have. They can, offer support or refer you to a mental health professional. There are also support groups and online communities where you can connect with other people who understand what you're going through.
It's amazing how many different aspects of health are connected when it comes to managing UC. It really shows how important it is to have this like holistic and personalized approach.
I couldn't agree more, and it really highlights the importance of having a healthcare team that you trust and can talk to openly.
Absolutely. This deep dive has been packed with so much valuable information. I feel like we've only scratched the surface. There's so much more to explore.
There is, and that's what's so exciting about, UC research. New discoveries are constantly being made, leading to better treatments and a better quality of life for people with UC.
I'm curious about some of the emerging trends in UC treatment. What's on the horizon?
Well, one of the most exciting areas is personalized medicine. Scientists are working on identifying biomarkers that can actually predict how individuals will respond to different treatments.
So tailoring treatment plans based on like your unique genetic makeup or other individual factors.
Exactly, exactly.
That's fascinating. What else is in the pipeline?
Fecal microbiota transplantation is showing some promise as a potential treatment for UC.
Oh, wow.
It involves transplanting healthy gut bacteria from a donor into the gut of someone with UC. The goal is to restore a healthy balance of gut flora.
Wow, that sounds both futuristic and a little bit strange.
I know, right? But it's a fascinating field with a lot of potential. And then there's, the ongoing development of new medications, including more targeted therapies that aim to suppress inflammation with fewer side effects.
It's incredible to think how far UC treatment has come.
Yeah.
It's really inspiring to know that researchers are constantly pushing the boundaries to develop even better therapies.
It really shows the power of scientific research and the dedication of those working to improve the lives of people with UC.
Okay, deep divers, we've covered a lot in this deep dive. We've explored the ins and outs of UC diagnosis and management, talked about the nuances of different treatment strategies, and even ventured into the exciting world of emerging therapies. But before we wrap up, I want to circle back to something you mentioned earlier, the importance of lifestyle factors. We briefly touched on diet, but what about other lifestyle modifications? Can those really make a difference in UC management?
Oh, absolutely. While lifestyle changes can't cure UC, they can definitely help manage symptoms and improve your overall well-being.
So let's talk specifics. What are some key lifestyle factors that people with UC should pay attention to?
Stress management is a big one. Stress can really make UC symptoms flare up. So finding healthy ways to manage stress is crucial.
Yeah, that's easier said than done. What are some practical strategies for stress reduction?
There are so many options out there. Exercise is a fantastic stress reliever. Even gentle activities like walking or yoga can make a difference. Mindfulness practices like meditation or deep breathing exercises can also be incredibly helpful. And then there's the power of social connection, spending time with loved ones, engaging in hobbies, or simply doing things you enjoy. That can help reduce stress and boost your mood.
All of those sound incredibly beneficial, not just for UC, but for overall well-being.
Right.
What about sleep? Does that play a role in UC management?
Oh, sleep is essential for everyone, but especially for people with chronic conditions like UC. When you're sleep deprived, your body produces more inflammatory chemicals, which can, worsen UC symptoms.
So prioritizing sleep is key. Are there any specific sleep hygiene tips that you can share?
Establishing a regular sleep-wake cycle is crucial. Aim for, 7 to 8 hours of quality sleep each night. Create a relaxing bedtime routine. maybe a warm bath, reading, or listening to some calming music. Make sure your bedroom is cool, dark, and quiet.
All great advice. It sounds like paying attention to these lifestyle factors can really make a significant difference in UC management.
It's all about taking a holistic approach to your health, addressing both the physical and emotional aspects of living with UC. And remember, these lifestyle changes aren't just about, managing symptoms. They're about improving your overall quality of life.
So true. This deep dive has been incredibly informative and empowering. I feel like I've gained a much deeper understanding of UC, not just the medical aspects, but also the importance of self-care and lifestyle modifications.
Well, I'm glad to hear that. Knowledge is power, and understanding your condition is the first step toward taking control of your health.
Well said. And to our listeners, thank you for joining us on this incredible journey.
Until next time, keep exploring, keep learning, and never be afraid to ask questions.
So as we wrap up our deep dive into ulcerative colitis, I'm I'm still thinking about all the information we've covered. It's just amazing how much there is to learn about this complex condition.
It really is a fascinating area of medicine. And the most exciting part is that our understanding of UC just keeps growing, which means new treatments and hopefully even better outcomes for people dealing with it.
You mentioned personalized medicine earlier, and it really does sound like the future of how we treat UC. Can you tell me more about that?
Well, it's all about moving away from that one-size-fits-all approach and creating treatment plans that are tailored to each individual. We know that UC is different for everyone.
Right.
The causes, the triggers, how severe it is, even how someone's body responds to medication. It can all vary so much.
So how do doctors actually personalize those treatment plans? Is it mainly about genetics?
Genetics definitely play a role, but it's more than that. It's also about your medical history, your lifestyle, your preferences, and even things like your gut microbiome. Those trillions of bacteria living in your digestive system.
It's like putting together a puzzle with all these different pieces of information
Uh,
to create a treatment plan that's just right for you.
yeah.
How do doctors gather all that information? Are there special tests?
That's where things get really interesting. Researchers are working on developing biomarkers, which are basically measurable signs that give us clues about your specific type of UC.
Okay.
That it could be genetic markers, blood tests, things we find in your stool, or even ways to look at your gut microbiome.
So imagine a future where you go to the doctor, get some tests done, and they can tell you, okay, based on your unique situation, this particular medicine at this specific dose will likely be the best option for you.
That's exactly what we're working toward. And we're getting closer every day. In fact, some personalized approaches are already being used. For example, doctors are increasingly using genetic testing to make decisions about thiopurine medications like azathioprine and 6-mercaptopurine.
Because those medications can have some pretty serious side effects, so it's really important to know who's at risk.
Exactly. Personalized medicine can help doctors pick the right treatment, figure out the best dose, and reduce the chances of those bad side effects.
This is amazing. It sounds like we're really on the verge of a huge change in how we treat UC. But what are the challenges in making personalized medicine the standard for everyone?
The biggest challenge is that UC is incredibly complex.
Yeah.
It's affected by so many different factors, genes, environment, lifestyle. It's like trying to solve a giant puzzle with a million pieces. But the good news is that research is moving forward quickly, and new technologies are helping us analyze data in ways we never could before.
So it seems like it's just a matter of time before personalized medicine becomes like the usual way we treat UC.
I think so. It's a really exciting time to be involved in this field, and it brings a lot of hope for people living with UC.
This deep dive has been a roller coaster. We've gone from learning the basics of UC to discovering these incredible advancements in treatment. It's been fascinating.
It has been a privilege to share this journey of discovery with you and our listeners.
To our listeners, thank you for joining us. Remember, knowledge is power, and understanding your condition is the key to living well with UC.
Until next time, keep exploring, keep learning, and never be afraid to ask questions.
And don't forget to subscribe to The Deep Dive for more exciting journeys into the world of knowledge. We'll see you next time.